Dementia cases are projected to double in the next 35 years. That's according to a recent CDC study. It's alarming. The Alzheimer's Association reports that more than 6 million Americans are currently living with the disease. And this new study is drawing attention to the importance of supportive health care. I want to now bring in neurologist Dr. Leah Croll at Maimonides Health. Dr. Croll, thank you so much for being with me this morning.
Good morning, Markie.
I mean, talk about the number doubling by the year 2060. What's driving that? Why?
There's a couple of things at play here. I mean, the first thing to consider is the fact that our life expectancies are getting longer and longer. Unfortunately, right, dementia is a disease of the old, and the older you are, the more likely you are to have some cognitive impairment. So sometimes it comes down to something as simply as we're living longer. The other thing to consider, and in some ways this is more concerning, is that we're learning more and more that things like obesity, high blood pressure, high cholesterol, diabetes, as they go unchecked and as their rates are rising, we are seeing a really detrimental effect on long-term brain health. So as our heart health is suffering, as our overall health is suffering, we're also seeing that impact brain function later in life.
Yeah, American diet not doing us any favors, I assume. You know, if you're like me, you kind of do the math. You think, okay, 2060, I'll be 70 years old then. That's kind of prime time for cognitive diseases like this to rear their ugly heads. What should folks be doing right now in these younger, healthier years to keep that at bay?
This is such a great question, and I have some really good news for you here, which is that about 6 months ago, a study came out and said up to 45% of dementia cases are actually preventable. So there's a couple of things we can't do anything about, right? Age, we can't do anything about. Genetics, we can't do anything about. But all of the other things that contribute to cognitive impairment, we really can be proactive about that. So that means working closely with your doctor to stay on top of blood pressure, cholesterol, diabetes, weight, taking care of your diet, making sure you're staying active. This is important. Staying on top of vision changes and hearing changes as you get older. You want to make sure that you're getting all that information through all of your senses in. You don't want to lose your senses as you get older. It impacts brain functioning. And really staying on top of unhealthy habits as well, like smoking or drinking excessive alcohol. These are things that actually add up in the long term and make a huge difference down the line.
Yeah, making those small deposits, those health deposits now really add up in the end. And hopefully in 35 years, there's so many new medical advancements that help alleviate diseases like dementia. Dr. Leah Croll, thank you so much for joining me. Appreciate your time.
Thank you.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.